Okay, we are back here. We are live at the Florida EAP conference in Melbourne, and we have a great opportunity to speak with Vaughn Bell. Yes,
Hi.
that's her name, Vaughn. I love the name.
It's a great incognito way. It's a male name, so nobody ever knows who I am.
Is that like a family thing?
It is a family name. I was named after Dr. Paul Vaughn, even though he uses a last name. And here's the funny thing is, I'm 4'9", and the name means Welsh. I mean, means small in Welsh.
You're Welsh? So
No.
am I.
Are you really? Well, yes, I am from that background, but yeah. Are you really?
Yeah, my father's name is Hayden, which actually in Welsh means lost in the woods.
Well, yeah, I'm small and lost in the woods.
I don't know where the hell he is.
We're small and lost in the woods together.
Oh, that's excellent, excellent. Vaughn, you're with Speranza Therapeutics. Is
Yes.
that Speranza?
Yes, new company, been around since January.
Oh, wow.
It's a biomedical company.
You picked a hell of a time to start a new company,
It
didn't
was
you?
not ideal. Actually, I've only been with them 3 months. So they started and walked right into COVID.
Amazing.
Yeah.
Amazing. And how have you been able to kind of weather the storm of this and trying to launch something new? And
One of the
when you're new,
things-
you can't really be in contact
Right.
the way you would want to be with a new company.
We've done a lot of our stuff on Zoom, which obviously is not ideal. But there's a lot of prep that has to go on too when you're a biomedical device and it's a new device. We were just recently FDA cleared a couple of years ago. We're new on the market. So we've just sort of focused on doing a lot of prep work in this downtime. We've done a lot of Zoom work. In the last 2 months, we've been able to start getting out and getting in front of folks. I come from 35 years of working in the addiction treatment space. And so once I joined the company in August, we now have begun to kind of physically get out in front of the folks that are here today. Treatment centers, providers. So we've prepped and now we're ready to come out with our message.
Well, tell us what you guys are doing. Do you have specific products that you work with?
We do.
Or what exactly are you doing?
The primary device that we work with is a percutaneous nerve stimulator that is a neuromodulation device.
I'm going to call time for a minute.
Yeah.
What was the first word?
Percutaneous.
Percutaneous.
Yeah, so it goes right here on your ear.
Okay.
It's a little device that sits again on the back of your ear right here, and you attach it to the ear with 4 little electrical sensors that deliver a small current to your vagus nerve. And that nerve controls a lot of the pain centers. It is the dominant control for the amygdala. And so when a patient is going through an opioid withdrawal, one of the things that those of us that have been in the treatment industry forever know is that that's a very uncomfortable withdrawal. You have a lot of sickness, you have a lot of cold sweats, you have a lot of nausea, runny nose, almost flu-like symptoms, and a lot of folks won't go to treatment out of anxiety about those symptoms because they've gone through it. I mean,
Right.
you know, if you run out of your drug and you go 5 days before you can get any more, that's a pretty ugly 5 days. And folks that have been through treatment before also know going through detox is not a lot of fun, even with comfort meds and the things that I might have access to. It's not pretty. So we believe this device can really be tremendously supportive of getting clients engaged in the therapeutic process because you put the device on them and they wear it for 5 days. It's battery operated and runs for 120 hours. And once you put the device on your ear and attach it, you can take the CAL score, your opioid withdrawal score, you can take that score from, let's say, 10, 15, 20, you can drop it into single digits within 20 minutes.
Really?
It's amazing. I've put it on a couple of patients, and it's just unbelievable. Within 60 minutes, generally 85% of those symptoms disappear. And so you can have a client who can suddenly get up and out of bed and go to group and get involved in what's going on in the treatment process because all of those physical symptoms that usually keep them very uncomfortable in bed, very miserable, and often very resistant to treatment and not happy about staying. You can get those symptoms down within 20 to 30 minutes. They have a significant reduction, and within an hour, they're almost all gone.
Well, I know that I've worked with holistic medicine in the addiction space years ago, and one of the things that was very big that we used to use was auricular acupuncture.
Mm-hmm.
So it basically works on the same principle.
Similar.
However, the auricular acupuncture was only available to them like twice a week or maybe 3 or 4 times a week, but just for that short period of time. So this is more of a constant stimulation.
Correct. It stays on for 5 days.
Yes.
And so you can use it in an outpatient setting or an inpatient setting because they don't need to stay in an inpatient setting to use it. And it continually delivers that current the entire time that the battery is functional. And generally, it's set to go about 5 days. So that's your typical detox period of time. And it's got a little port in it, so we can double check it and see if it's still working.
Sure.
Sometimes we have what you call attenuation. The nerve gets tired and stops receiving a signal, and so you can unplug the little bottom lead off your earlobe, pop it off for 10 minutes, reattach it.
Because of the stimulation, you actually become numb to the stimulation.
Exactly, that's exactly right. So yes, you have results for the entire 5 days. Now, if you take it off, it quits working. But in that 5 days, as long as you leave it on, then you're going to have consistent management for the most part of those symptoms. And then ultimately you come off of your detox and you no longer need it anyway.
So there's probably, there's tons of science, and I'm sure they can go to your website and learn more about the science and everything. Let's put the science aside. Let's talk about the reaction you've gotten. Real world reaction. What are you seeing?
It's pretty amazing to watch a patient put this on their ear and not know what to expect and see the physical response happen so quickly. My favorite example is a patient that we put it on in Las Vegas a few weeks ago, that she was coming off of 125 milligrams of methadone and wanted to get off of that. That's a pretty high dose. She'd been inpatient for several days, was very miserable. She came into the room, she was shaking, she was freezing, she was sick to her stomach, she'd been throwing up. We put the device on her, and within about 20 minutes, she was literally shaking like this. And within like 20 minutes, she settled down, and her shaking became very intermittent. I saw her about an hour later. I asked her how her stomach was. That was much better. Her anxiety was coming way down. An hour later, I was sitting in one of the offices and looked out. She was sitting outside, and I said, "Look, there she is." And they're like, "No, that's not her." I'm like, "Yeah, that's her." And they're like, "No, that's not her." I'm like, "No, that's her." We went out and talked to her, and I said, "How's your anxiety?" "It's gone." "How's your stomach discomfort?" It's pretty much gone." "How's your trembling?" It's gone. Now, she still had some symptoms. She was still achy. I think they continued to give her some comfort meds. You can use it in conjunction with comfort meds.
Sure.
But what was so funny was when she walked in, she looked like death warmed over. She felt so sick. And when we saw her out the window, she was out there sitting in the sun with a cigarette in her hand. She had her earbuds in. She's singing along to her iPhone. It was a different person. And she got up and went to group.
Wow.
So that was a person that had been in bed for 4 days, and when they said, "Can you get up and go to group?" an hour later, she chose to go to group.
You light up when you're talking about that experience.
It's exciting
because
stuff.
It really tells you you're doing the right thing.
Yeah, as a clinician, it is amazing to watch it because I've sat and watched a million patients who have sat there and laid in bed just feeling like death warmed over.
Yeah.
And suddenly they have a sense that this could really be something they can overcome.
Well, let's be very clear on this. We're not talking about a cure for addiction. We're not talking about a miracle device. We're talking about something that will take enough of the physical edge off.
Correct.
That they can somewhat focus, at least get a jump start on focusing, so they can really do their therapeutic work.
And I think what's really important about what you just said.
Right?
Yes, what you just said is very important. This is not treatment.
Right.
This is a tool within treatment. It's a physical withdrawal management device that helps you with those symptoms. We're not treating the illness. You are. The treatment provider is. We now enable this patient to get engaged in your treatment, get them involved in what's going on. But this really changes the landscape for them in terms of getting that early buy-in to your treatment program, whatever that may be, because they feel like they can get connected and engaged. And when they have that spot later when they're like, "I don't know if I want to do this," you've already had a chance to get engaged and connected with them.
Right.
And when it comes to time for that, which so many patients do, start thinking, "I don't know if I want to do this, I want to leave treatment." Half the time, because of the detox process, you've not had much time to bond with them and get connected. Now you can, because they can get into your program. And so we believe it also is going to help people stay engaged in treatment longer.
Well, it's a pleasure having you here at the Florida EAP
Thank
conference.
you.
You've been able to meet some great people
We
and
have.
make some good connections.
Yeah, we have. Having been in this industry for as long as I have, I've been in South Florida a lot. It's been great to see old friends, but also to see them in a different light. We've talked to treatment centers that have been my peers, and now are folks that I think we can really transform their program, so it's very exciting.
I know you were with Addiction Training Center, shameless plug.
Yes.
You were with us yesterday for the training. How did you feel about the training?
It was an excellent training. I actually texted my husband, who also does interventions. He's a private practice therapist. I was like, guess what? I'm getting certified as an interventionist because I've been in this space forever, been a clinician, but never actually sat through a full intervention training. It was really well done. And as long as I've been in this industry, I picked up some things that I didn't know in there. So it was very exciting. Good stuff.
Well, we appreciate that.
Very good stuff.
It's a joy to have somebody coming in with a new look at how to help treat addiction. And like I said, not a treatment, but this is like a therapeutic tool that can be used to allow the real work to be done.
That's right.
I guess if we want to put it in simple terms, it's the Novocaine so that you could take the mind off the pain while you're doing the work on the tooth, but the work still has to get done.
Yeah, pretty good analogy.
And you're always going to say that the work has to get done.
That's exactly right. You have to go into long-term treatment after this. This is not something you stick on somebody and then let them go back to work. This is something to get you into treatment.
Now, how can somebody find out more about you? And are you looking at just communicating with treatment centers, or are you looking at treatment with helping with individuals as well?
Just treatment centers, because as you just pointed out, you have to be connected to a long-term plan.
Correct. Okay.
But we can work in outpatient, inpatient, ambulatory detox. Multiple settings are options for us. So our website is www.speranza, SPERANZA, therapeutics.com. And my name's Vaughn, and I can be reached at 502-500-2937 if you'd like to hear more about it.
Vaughn, absolute pleasure.
It's been a great time with you too. Thank you so much, dear.
Thank you.
All right, take care.